Time management. Number one, do the things that are going to blow up first. Stuff that's going to fall apart, things that are off the rails, do those things first. I think that this is
Mm-hmm.
obvious. Obviously, we're going to prioritize everything just like the NCLEX says that we should: airway, breathing, circulation. All those things come first. We talked about Maslow's hierarchy of needs. We got to fill the base first before we can get up to self actualization, intimacy. All of that stuff is later on. Doesn't matter if we haven't
Mm-hmm.
met the baseline first. So that's an NCLEX concept. You can take that to the bank. You do those things first. If those things are impaired, if those things are infringed upon, you have to take care of those things first. So if you're looking at a question, if those things are affected, take care of those things first. In real practice, if those things are affected, take care of those things first.
Mm-hmm.
Do the big
Right.
stuff first.
Right. I think another important thing is just as a practical tip, cluster your care, right?
Yes.
The more you can do when you have the time and you go into a room and you're like, okay, this technically, not counting like scheduled things, but like this technically doesn't have to be done for another 2 hours. If it can be done then, just do it. It
Yeah.
will
Hey,
make your
I'm
life
here and there's
so
nobody
much easier.
pulling me out of the room, so I'm going to do it.
Hmm.
Right.
That's why we always talk about charting at the bedside. If you're having a good start to your shift and you have the chance to, that's part of clustering your care, is just getting it out of the way, doing what you can, setting yourself up for success. Cause like you don't know what's going to happen in the next 12 hours of your shift or 8 hours or
Well, and
whatever
I
it is.
think sometimes people think that like we have to do all these like, oh, well, you have to do Q 2 hour rounding. And I always ask students this: why do we round every 2 hours? Anybody know? And the answer is always like, well, because that's standard of care. Okay, but why is it standard of care? So, and here's the answer: it's standard of care because Q 2 hour rounding came because that's how long it took Florence Nightingale to walk around the camp in the Crimean War. So when she
Huh.
was
I
rounding on
didn't
her
know that.
patients, that's how long it took. There's no evidence or magic to every 2 hours. Can your patient develop a pressure sore in an hour? Absolutely. Can your patient develop a pressure sore in 6 hours? Sure. The number is arbitrary. Okay. It's something that nurse leaders have put on. But Q 2 hours originally came because of that. It was like, okay, so it took Florence and her girls 2 hours to go around and see everybody, and they'd be like, we'll be back in about 2 hours because that's about how long it takes us. There's no magic in that. It's just an arbitrary number. So
Hmm.
if your patient needs more help before that, go help them if you're available. If your patient can, if you get busy doing other bedside care and it takes you a little bit longer, there's no magic in that 2 hours. Now, your facility